So, what do big campaign contributions from pharmaceutical companies to Congress have to do with the inability to get your IBS treated properly? Well, more on that in a second. But let's talk about a complaint I hear frequently from my patients. And that complaint is it seems like no matter where they go or how many second opinions they get for their problem, they seem to get the same set of tests that don't show anything, and they get the same treatment protocols that really don't do anything except for treat their symptoms. Nothing takes care of the problem for good. So why is it that no matter where you go, no matter who you see, you seem to have the same things done to you? The reason for that is what's called treatment guidelines. So what happens is that you have these big medical organizations, and then they set up what's called consensus panels. And these consensus panels are made up with doctors and researchers that are experts in their field. And usually they have a lot of experience, so they've been around for a while. And they get together and they sift through all of the research regarding a particular condition, and they try to find out, well, what's the best way to deal with that? How do you diagnose it properly? How do you treat it properly? And then they develop what's called these consensus guidelines or treatment protocols. And then when your doctor's reading their journals on a regular basis, hopefully they're doing that, when they're reading their journals on a regular basis, trying to stay current, they see this article written by these consensus panels, and they get to see, okay, here's what the latest research shows. So what's the problem with that? Well, in theory, it's really good. In theory, we want to have the latest, the newest research. We want to try to do what's best for people. It's hard for each individual doctor to stay current because they have to deal with so many different conditions. So this whole system really makes sense. So you have these experts, these panels, they put together all that, and then they have an article or they write a summary so that when your doctor reads over it to become current, they know exactly what the latest research is showing. So in theory, great, perfect. In practice, it's a little iffy, I'll say, to put it nicely. And the reason being is because in order for this to work, we have to assume that the people on these panels are the best, the brightest, they're free of influence, and there's only their best intentions in mind to improve our society. So they're just trying to do the best for everyone involved. The problem is that that's not always true. And as we'll see here in a second, I'll show you this article, that there's a lot of money that kind of finds its way into the people on these consensus panels. So that kind of brings up some questions on whether or not that what they're putting out is objective and is what really is the best that's out there according to the research. But let's take a look at an article here that kind of outlines what we're talking about. And this article talks about, let's go to the title here, Policing Big Pharma's Influence Over Doctors' Treatment Guidelines. So exactly what we're talking about here, these consensus panels that are within these different organizations. And it just so happens that this article is focusing on gastroenterology specifically. So as far as your IBS is concerned, this directly impacts probably the treatment that you have already received and may receive in the future. So if we scroll down in the article here, one thing that stuck out to me was the author says, especially worrisome to Vassar was his finding that the majority of the gastroenterology guideline authors failed to disclose industry payments that were reported in a federal database. So normally when you are involved in research or when you're involved in committees that are setting public policy or setting professional guidelines, you should disclose who's paying you and who's giving you money. And in this case, if we go down through here further, the payments varied from $1,600, not a big deal, that's not going to change your opinion, but to $102,000, so six figures. So, I mean, even if you are the purest and most ethical individual, well, in that case, you won't be taking this money and then sitting on the guidelines panel. But let's assume that these individuals, these doctors and researchers are trying to do the best they can. If you're getting six figures from someone and there's any question on whether the guidelines are going to be written in a way to promote that particular company's product or not, or promote against it perhaps. We see many cases where drugs can end up doing more harm than good, but are you going to be as outspoken if they are paying for, I mean, $100,000 goes a long way, and it's more than a couple of years' salary for a lot of people. So I would suspect that maybe you wouldn't be totally objective. So I mean, that's a problem, and it's recognized in the healthcare field. You have articles such as this one. If you look on PubMed, which is peer-reviewed journal articles, there are many that are written with this problem in mind, and they don't know what to do about it, to be honest. And they try to reduce the influence by disclosing your payments. So somehow if you say, all right, I'm getting paid $100,000 from this pharmaceutical company, but no, it won't affect my judgment. I guess that's supposed to help the problem or solve the problem. I still suspect not. The fact is that these people shouldn't be getting this money at all if they have any say over what the guidelines are, especially when it involves making decisions to recommend for or against that company's product. So that's a problem. But the nice thing is we have a level of oversight. So we have people that oversee these guidelines, these committees, and the pharmaceutical companies. And that's the FDA. And then ultimately, the FDA answers to Congress. But let's take a look at this article that I kind of started off describing at the top of this video. And this article talks about corruption within Congress from Big Pharma. So as I said, how does campaign donations from pharmaceutical companies to Congress affect your IBS treatment? Well, here's how it does that. So we have the guidelines, the people that make the protocols or make recommendations for your doctor to follow. There's some questionable issues there with money being paid to those people on those panels. And not only that, we have the people overseeing these panels and the drug companies. They are being paid by Big Pharma as well. And you have the quotes here from Dr. Brown, who is a committee member on the FDA. He is saying that the pharmaceutical company pours millions of dollars into the legislative branch, that's your congressman making the laws, every single year. In 2016, they put $100 million into the election, and he thinks that, quote unquote, nothing will happen as far as Congress speaking out against Big Pharma because Congress is owned by Pharma. And if we thought that the committee members getting paid up to $100,000 was bad enough, now we have these Congress members, and usually these Congress members are paid more by the pharmaceutical companies and other lobbyists because they're on committees that directly impact their industry. And you have on the high end here, we have senators, 532,000. Bob Casey, my senator here in Congress here in PA. And then on the House side, you have Greg Walden, $460,000 to his campaign. So again, what level of objectivity do you get when you're dealing with people that are supposed to be involved in making decisions against these companies when you're getting paid so much and when you're getting so much donations towards your re-elections? Now, I'm what you call a functional medicine practitioner. And whether it's chiropractors like myself or MDs or DOs or acupuncturists or dietitians, you have practitioners that are leaving what we'll call conventional practice due to some of these problems. One of them being corruption in our guidelines makers. So, and the other thing is that we understand that people are individuals and everyone's different. And yeah, you can go look at the research and kind of get some trends and kind of get an idea of what might work best for people. But the fact of the matter is that no one has the same type of situation that you have. We all have different jobs, we have different environmental exposures, we have different levels of stress, we eat different diets, we eat different foods, we do different activities after work, we have kids, we don't have kids. There's just lots of variables that go into the makeup of a person and then therefore affects how their health is. And because of that, you have a variety of causes for these problems. So doing the standard testing and applying the standard protocols to everyone the exact same way isn't always the most effective way at taking care of people's problems. And if you're dealing with IBS, chances are you've been through all of this stuff before and it hasn't worked for you. So now it is time to try something different. And one thing that we do, since I don't have a boss, I don't have to follow these specified protocols. No one's going to be over my head asking me, well, why am I ordering that test or why am I doing it this way? So what I try to do is find the most effective testing and then try to design the most effective treatment protocols. One of those tests that we do a very comprehensive digestive analysis, and we try to find out, well, what's going on with a person's gut, for instance. So we know through my training, we understand that there are several different types of gut bugs that can trigger IBS type symptoms. I mean, that could be worms, could be virus, bacteria, yeast. And if you're giving the wrong protocol or wrong medications for the wrong bug, so to speak, you're not going to get the results that you want to get, or you might get temporary results. You won't get permanent results. We even know to go into history and find out, well, when exactly did your symptoms start? And does it correspond to a particularly stressful event in your life? Or were you on vacation in Mexico? Or were you overseas? Or were you at college? I mean, there's a variety of things that go into triggering the IBS symptoms. And from that, it gives us clues to help us figure out where the root cause may be. Or it might have to do with timing. We get some clues that way. So if you have bloating and stomach pains within an hour of eating, it could mean one thing. If it doesn't happen until hours later, or maybe the next day, it could mean something else. So the idea is to really drill down and try to find the root cause of people's IBS symptoms, so that we can then address those root causes and not just suppress the symptoms. And once you address the root causes, that's where we start to see changes permanently. Not temporarily, not for a few days, not for a few weeks and have it return again. We see people get better and stay better long term. And the whole key in that is addressing the root causes. So if you want to learn more about this and learn more about how I practice as a functional medicine practitioner, and we throw in a little bit of this, well, how do the guidelines get screwed up and the corruption there, and why do doctors only order a set number of tests? We go through everything in this presentation. So if you have IBS, you've been struggling for a lot of years, you won't want to miss this. So click on the link above or below this video and watch the presentation. I know you're going to learn a lot, and then if you need some help, and I'd be more than happy to offer that help to you. But there's a lot of stuff in there that you're going to be doing on your own. You're going to be able to do on your own. So again, click on the link above, below, and I'll see you there.